Hi friends, welcome back to Chilmark Research and our video series talking about the healthcare IT industry. Today we will be meeting with Jody Rank, who is co-author on our latest report, Addressing Social Determinants of Health, Engaging Community Resources. All right, Jody, to start, can you tell us a little bit more about exactly what social determinants of health are and how they are being defined in the healthcare system today?
Well, thanks, John. So first up, if we want to, when we think about the social determinants of health, what we're really talking about are these quantifiable measures about the social context, environmental context where patients live. So we're looking at capturing the data on their income, educational levels, the geospatial barriers to access to care, for example, how far away they are from a clinic and access to transportation, language barriers, and even things such as your access to nutritional food, because as we know, many people live in food deserts and don't have access to affordable, high quality fruits and vegetables and so forth, and they're more likely to have a diet and fast foods, for example. So all these social determinants can come together in a way to structure the environment that also influences their personal behavior and can lead to poor outcomes in many cases. So that's what we refer to when we talk to social determinants of health.
Great, thank you for defining that for us, Jody. So the next question I have is, why have social determinants of health become such a key part of the conversation in healthcare today? And what have been some of the challenges around actually incorporating this information into clinical workflows and clinical processes?
So when it comes to the actual challenges of implementing a social determinants of health type of program for providers and their patients, some of the key challenges have to deal with actually just getting the information on who are the community service providers that can address which issues, and then getting the data to understand how they work and what are the outcomes associated with those services. So then actually, once you identify who they are and which are the best providers for a given social service, we then have to build a relationship and build trust, and then that also involves we have to share data outside of the clinic and across these silos. And as we know, it's bad enough or difficult enough to share data within the healthcare system. Now you're talking about another layer of service providers and moving that data across different institutional boundaries. So that's a very big challenge for most organizations. So solutions that can sort of bring down those costs, but also get that data, that's a very important resource. So those are major challenges organizations face in getting access to that data on who's doing what, and then governing and moving the data, and then having the proper governance mechanisms in place to sort of manage that data. Those are all very big challenges at the moment.
Okay, so clearly this hasn't been the easiest thing to start incorporating into the way that we provide care in America, but it's important, and it's become increasingly important. That said, we chose to specifically focus on the use of social determinants of health in engaging community resources. So could you give a little bit more explanation as to why we chose to focus on community resources instead of the other applications of social determinants of health?
So the reason why we focused on looking at the vendors that had solutions that help address these sort of the data needs around community partnerships is related to what the main challenge I just mentioned, in that healthcare providers often do not have, or typically do not have, the data around who's doing what. And so what the vendors were looking at, what they do is try to take the work, there's a certain amount of legwork and digital work that goes into integrating the data and sort of information about the resources that are available for a given problem a patient faces, and then making a referral and perhaps working with care coordinators and so forth to do the follow-up to make sure the patient indeed accesses those resources. So the solutions we're looking at in a report really address this need of the providers for access to this data on community resources so they can do the adequate referrals when needed. And so that's why our report is heavily focused on that issue.
Thanks, Jody. That's great. So in closing, is there anything else that you would like to add just about the importance of this topic or how we'll be covering it in the months ahead?
So what does the future hold for this social determinants of health space? And I think a big part of that future is really intimately linked to the current pandemic that we're facing. What the pandemic has really shed light on is just how important social determinants of health are. Because if you look at the burden of disease and who's getting infected the most and experiencing the highest disease burden and death rates, they're often the poorest, those living in Black and Latino communities. Those individuals and communities have borne a disproportionate burden of the disease with SARS-CoV-2. And so we absolutely have to take these issues seriously to address those who are sick now, to protect them from getting sick in the future. But then also when we think about pandemic preparedness in the future, what would that look like when you have unequal access to healthcare in this country so that we don't repeat the same mistake over again? So I think going forward, as we begin to build the models for resilience and pandemic preparedness, social determinants of health are going to have to figure quite prominently in those plans. And if they do not, they're not going to work. And we could, go through the same type of, basically tragedy that we're currently going through if we do not take social determinants of health seriously. So they're going to be vitally important as we build that bridge between the formal healthcare sector and public health. That link that has failed to protect people in the current moment, we need to build those bridges and fix that gap between the systems. That's going to be an important piece of work, whether we're looking at disease surveillance, down to care, individual care, down to community responses to a pandemic. What we do now around this will build greater resilience in the communities and into the healthcare system to respond more quickly in the future. Thank you.
Thank you for joining us this afternoon, Jody, and sharing your insights about social determinants of health. And thank you for joining us on this video today. We hope that you enjoyed the content, and we hope that you'll mark your calendars for November 10th, 2020, when Addressing Social Determinants of Health, Engaging Community Resources will be released to the public. Please also subscribe to our newsletter or our YouTube channel to receive regular updates when we launch new content. Thank you for joining us today. If you enjoyed what you watched here today, please subscribe to our YouTube channel by clicking this link. And if you'd like to see other content that's related, you can click here or here. Thank you for joining us today.